Depending on the age and underlying health conditions of your baby, you may not need to go to the hospital if your child has RSV or respiratory syncytial virus. The majority of RSV cases are mild and may only cause cold-like symptoms, which can usually be cared for at home. You should talk to your pediatrician about medications that are safe for your particular child and supportive measures that you can take. But generally, you can manage fever and pain with over-the-counter fever reducers and pain relievers such as acetaminophen or ibuprofen. But you really should make sure that you have the specific dose based on the weight and age of your child. Aspirin should never be given to children unless directed by your doctor for specific conditions because it may increase the risk of Ray's syndrome. This is a rare but potentially fatal disorder found almost exclusively in children and adolescents. One of the most important things you can do is get some saline spray, which can actually help break up the mucus in their nose, and also a suction if you have a young baby or an infant. They can't blow their nose, so you can actually help suck all of the mucus out of their nose, and those are really important to help decrease the postnasal drip and also help them breathe. It's also important to make sure your child is getting enough fluids to prevent dehydration. So giving frequent sips of water, ice chips to suck on, or you can get some rehydration solutions such as Pedialyte. You can also give them some flavored ice pops that I love to do because then you can make sure they're taking it slowly, it's refreshing, and they also are staying hydrated. You do want to limit the amount of sugar given in drinks like juices, as these can also lead to diarrhea and more dehydration. Signs of dehydration in infants and children include noticeable reduction in energy to play, urinating less frequently for infants, fewer than 4 to 6 wet diapers per day, parched, dry mouth or cracked lips, fewer or no tears when crying, sunken eyes or soft spot of the head in an infant, increased fussiness, cool, discolored hands and feet, a racing heartbeat. Contact your doctor or pediatrician right away if your child is showing signs of progressive dehydration or is consistently unable to drink water. You should also seek urgent medical attention if your child is having difficulty breathing or is having a prolonged worsening course. Contact your doctor for more tips on taking care of your child with RSV at home.